everyone. Our project is a smart heart patch for congenital heart disease.
Congenital heart defects, or CHDs, are structural problems in the heart or major blood vessels at birth, and they're the most common types of birth defects, with 1 in 100 with U.S. alone. There are many different types of CHDs. The most common one is ventricular septum defects, or VSDs, which is a hole in the heart, and that's what we're going to be focusing on.
The current clinical requirements and complications we need to be concerned about include scar tissue formation and other common post-op complications that we see a lot with the artificial patches that we'll talk about in a moment. A lack of growth potential. The artificial ones don't grow with the child's heart, which usually results in multiple invasive heart surgeries over the course of their lifetime to remove the patch and replace it with a new, bigger one. And we also, of course, need to be worried about the immune system rejecting the foreign materials, as is extremely common with implants. These kinds of surgeries and procedures come with risks of blood clotting, which means you need anticoagulants involved, internal bleeding, it's a hole in the heart, that's where all the blood is, endocarditis, which is just a bacterial infection of the inner lining of the heart, and calcification.
Two of the most common VSD patches currently used by surgeons now are Dacron and Gore-Tex. They're both synthetic polymers, meaning they do not dissolve or degrade over time as the child grows, meaning, as Ian said, as they grow, they're going to need multiple invasive surgeries.
So competition and alternatives. So current cardiac patches are made with autologous pericardial tissue or synthetic polymers like Dacron and Gore-Tex. These offer improved mechanical strength but lack biocompatibility of our hydrogel patch. With synthetic polymers, they can result in tissue necrosis and inflammation. And with autologous pericardial cardiac patches, they are less immunogenic, but they are stiffer than myocardial tissue, which leads to biomechanical mismatches. So without the improved biocompatibility and biomechanical properties of our hydrogel cardiac patch, it can result in reduced function or tensile failure.
So our approach to repairing VSDs focuses on 4 different steps. The first is we would select a biodegradable and bioactive hydrogen material that mimics the heart tissue with optional reinforcements like Dacron. Second, we would load the patch up with bioinductive agents such as heparin to prevent blood clotting and growth factors to promote regeneration. Third, we would embed nanoparticles to allow for controlled drug release, as well as electroconductive particles to restore electro function. And then lastly, we would test the patch in vitro and in vivo models to confirm the performance.
So for our design criteria, biomechanically, our patch must match the elastic modulus of native myocardial tissue. Additionally, it must match the mechanical stiffness of adult cardiac tissue, and it must be able to withstand the pressure of the left mammalian ventricle, considering that's the highest pressure chamber in the heart. And then biocompatibility-wise, it must be degradable into non-toxic byproducts such as lactic acid and glycolic acid, and result in no blood clot formation. And then biofunctionally, it should deliver growth and anti-inflammatory factors to result in tissue regeneration, and should be self-healing and adhere to cardiac tissue.
So as our patch design, it sort of looks similar to the Gore-Tex or Dacron, but it's obviously made out of a smart hydrogel like Gelma. Just to let it dissolve as a child grows and only need one surgery. That kind of just, they get once and then they don't need multiple ones. It also includes drug delivery system and electroconductive particles. In case the patient needs extra growth hormones or other drugs, it's able to release those factors as it degrades. Also, with biomaterials or devices that are implanted near the heart, they need to be electroconductive. If not, they can cause heart arrhythmia. Another thing we were thinking about is an adhesive surface. So instead of suturing like the Gore-Tex uses, instead of like invasive suturing, it would just sort of stick or sit on the hard tissue.
You guys are at time, just so you know.
We'll finish this up real quick then. Just a bit of a cost-benefit analysis. With these patches, you would only need a single surgery, which obviously saves on a lot of risk and a lot of cost. The current estimated out-of-pocket cost for patients is in the realm of $200,000, which is absurd for something that you need to live. The patch itself may end up being somewhat expensive compared to the non-inductive materials like Dacron, but this cost is easily balanced out by only needing one throughout your lifetime, as opposed to needing many to replace and remove the patches. The exact figures are unknown. We need to select exactly the materials we want everything made out of in order to get exactly how much a patch would cost, but current estimates is somewhere in the realm of $500 to $1,000. Thank you. Any questions?